just one request. Maybe you want to start the timer so that I do my job best. Reverse countdown will help me to know. So once again, thank you so much, all the panelists for joining this session, and all who are present in this room. We are really overwhelmed with the presence, and we really hope that we do justice to kind of the inquest what we all want to kind of achieve. As suggested by Anubhati, we will take the questions at the end of the once we finish with the views from the panelists. But please do note down your questions, and we will definitely have at least allocate 10 minutes or 15 minutes for the Q&A later on. So I think what I want to say is this is an exciting session where we will have the learnings and experience sharing from the CSR perspective, also from the large scale health industry, as well as the policy and ethical. So please be attentive. When kind of, we read this kind of stuff, but in general, I am also come from that medical background, and typically what we say, and there is a famous saying, health as our attention, I think we don't give that much. Health is not valued until the sickness comes. Whenever there is a sickness in house, only then people realize that, okay, please start caring yourself, and then like we start something. And this is potentially, or everyone, each of us as citizen or the countries together experience in last 2 years. Overall, people realize that like without health, then there is no progress or the economy at the scale. We witnessed the huge scenario change for the Indian healthcare system as well, where we now see great enthusiasm, great collaborations between all stakeholders. And this is the right time, again, to discuss this matter. So just before we start the kind of getting this perspective from the panelists, I'll just give 2 cents of USAID just to make sure that like where I'm coming from. So USAID works with Government of India since more than 70 years now in betterment of the health of the Indian people. And in general, for this particular segment of the tech, we come into play 2 ways. One is, of course, we support innovations where either introducing new technology or maybe a betterment of the process. We do so with kind of providing support to some of the implementing partners where they implement that at reasonable scale, which government can then take up. Second, where the USAID comes is the responsible use of the technology. So we are a signatory to call for the digital development principles. Also, we are the signatory for the principles for the donor alignment to the digital health. So where, and these 2, I think, are really important as a co-investor or who all are operating in this firm, it will also equally applies to all. So for further kind of it from the USAID, but now let's go to our esteemed panel, and maybe we'll begin with Dr. Kirti first. And I think based on your rich clinical experience, what you bring to the table with your previous institution and now, so my question is mainly a twofold. One, maybe you want to kind of briefly provide an overview of the Metropolis current support areas in the health, and how do you see the tech component in that? And also, because you were the forefront runner for the COVID response in the country, would like to also know some of the lessons which pandemic has brought down for the healthcare system. So that over to you. Thank you.
Thank you. That's an actual sigh. When somebody talks about COVID, my whole life spins in front of me. I cannot talk about COVID still without choking because now, we are all like, we've been there, done that. Everybody's sitting very super confident, but that was not the scenario. And every time I talk about COVID, I'm pulled back into that. So, but it taught us a lot and it gave us a lot. It gave healthcare a lot. So I think no healthcare professional will ever, I still getting goosebumps. So on the emotional side, you will not believe it. I literally told my sister that, you'll have to adopt my children because my husband and I are both doctors. And we were knowing that we are going into a COVID zone. But on the technical side, things just immediately changed overnight. So, coincidentally, I was at the US CAP presenting a paper on digital pathology, which at that point in time, whether it was seniors or whether it was colleagues, everybody said, digital pathology kaun karega? Don't waste time, don't waste money. And there I was, still, we had done it, we'd won an award, I was presenting a paper, and suddenly the next day, I see everybody treating me a little different. Because, if you're Asian and you were there, you were a potential COVID suspect. And I just happened to choke on the water a little bit and everybody, just distanced themselves. And I was like, what just happened? And then I realized that when I go back to India, life is going to be very different. And I recall that, we were the first, Metropolis was the first to develop, to roll out the test in the private sector. And believe me, that was not easy because we had to overnight, get the kits from Germany. We did not, sorry to say, at time trust anybody over here because we knew that, we have to offer the, the best because that's what people expected from us. I had to actually, I realized two things very important that time, and that's why health tech is very important. Scale is not possible without technology. But you got to know what you want to scale. So if I can pass on one message to everybody about health tech, don't do it because everybody is doing it. First, know that you have a problem, and then you know that technology is going to solve it for you. If you don't have a problem and you just build the tech, you'll be just troubling everybody from your IT team to digital to the consumer, user, patient, everybody, So I think just identify that which is your pain area, So for me, what happened is that we had the test, and then we couldn't scale. I mean, it was so troubling. I mean, I used to sit with these manual sheets of people who have expired, people who are going to expire in the ICU, pregnant ladies who had to deliver. And I was like, how do I prioritize this? This cannot be based on my wish, right? It cannot be a random. It has to be based on algorithms, AI. It cannot be like that. And that's where we realized even ICMR, we just treat it like the single source of truth. So that's another thing. If you have information, be willing to share it. Just hoarding it is not going to help anybody. Because until the information is seamlessly transferred. So the huge difference between West and us still is that, though we are rapidly galloping, but the huge difference is that we are still, working in silos. And that's why I look forward to events like this where, we have to break these barriers. And that's why public-private partnerships are a great way to go. Inter-organizational things are a great way to go. If somebody's developed a technology, just use it. Don't try to reinvent the wheel. So basically, I think what we have to learn from the next generation, I think anybody who has a younger cousin or a kid over here will know that that person is smarter than you. Cross your heart, they know they are smarter than you. So basically, just take a cue from that, and just you are experts in health, we're experts in whatever we do, right? Whether it's a development sector or CSR or whatever it is. Like, to answer the second part, the first part was that. The second part is CSR, right? Now, Metropolis has been doing a lot of CSR in different ways. We have a beautiful program called Too Shy to Ask. And whoever has a young girl in their house, just tell her to download Too Shy to Ask app. And whatever she's too shy to ask anyone, she can just ask an expert online in the comfort of her house without, being worried who's going to look at it. It's in 5 languages. So that's how you scale it. Now, if I had to do Too Shy to Ask without an app, I'm not going to go pillow to post answering everybody's questions, right? Similarly, we have a program called MedEngage. MedEngage is for young medical students. You don't need any connection. You just need an internet connection. Go on the Metropolis website and, whatever you need. You need funds, you need research discount, you need observership, internship, all the things that a medical student needs, but nobody gives him. Once you become a doctor, the world is at your feet, offering you this and that. But while you're becoming a doctor, nobody cares about you. So we reach out to those guys. But again, now we have, it's online. So everything, once it's technology meeting the need and the expert deciding what the need should be. I think that's the beauty of it all, and that's the only message I want to give.
So thank you so much, Dr. Kirti, and I think I 100% agree. When we talk about India, we have to talk about scale, one, and just working in silo, just developing a technology doesn't, it has to work in a larger ecosystem. And I think that starting from that thought process really can kind of take you the long way. So maybe, thank you so much, and maybe now go to Mr. Ashok, who represents MediBuddy, a very large digital healthcare provider platform, and Ashok is also having 20 plus years of experience in insurance. And just inquisite on that, we know the government of India has a very, very ambitious plan. What they are doing, and at our USAID internal meetings, what we end up talking about is how can we cope up government of India in our approach. Most of the time what we are thinking, and then we see a policy launched by government of India nowadays. Similarly, let's say what in health, Ayushman Bharat, where they have the health and wellness center of 150,000 health and wellness center, the PMJY scheme, and also the ABDM, which is the integrated digital health infrastructure. So looking at that lens, what maybe would request you to provide. One is what trend you are seeing post-COVID on this factor, whether this digital infrastructure, whether it is going in a right direction. Also, because you are from the tech, digital tech health company, what you see is what are the drivers basically to adopt this technology at scale in India? And of course, I would also request you to provide some little bit more insight of your MediBuddy, which can help the audience to understand better.
Yeah, thanks, Dr. As a way of introduction, MediBuddy is a digital healthcare platform. And as the thematic session says, healthcare for good or health tech for good. Health tech is the bone or the backbone of our company. Our aim is to deliver the good, which is the affordability, accessibility, and quality to the clinical care. So we predominantly operate in the primary healthcare space, which essentially means we offer remote consultations with the doctors, specialists, which could be your tele or video consultations. And then if every consultation, of course, comes with a prescription, and every prescription, at least 2/3 of them generally tend to have a lab or a prescription for medicine or both, right? And how do we kind of provide the continuum? So when you go to, for example, a physical clinic, typically you will have a prescription, and then you probably will have to walk out to get a lab test done or a medicine done. The way we work is, it's a kind of a continuum care, right? And that's where the health tech comes in place. And before that, I will probably come to that point. Once the doctor writes a prescription, right, the prescription automatically generates and kind of takes you to the right network of labs which we provide. And we also provide home delivery in terms of someone, a phlebotomist, that's a trained person who comes to your home to kind of take your samples and deliver it to the lab for the testing. So that's seamlessly done. And further, then when there is a prescription for medicine, that's delivered to home. Today we are in a position, because of the technology which we integrate, both the front end, the provider, and the back end delivery capabilities, we are able to deliver to at least 96% of all PIN codes in India, pharmacy medicine, right? So of course it has been a journey. It has taken us for almost 8-9 years to get where we are. And I was sharing with Dr. Amar that there was an era prior to COVID. Of course, like Dr. mentioned, there are not so good memories associated with it, but the good part which came out of it was a great adoption in technology delivery side of that, especially in terms of doctor consultation, the labs required at home, because no one was willing to go out to have a doctor consultation. No one was willing to go out and to a lab or a hospital to have their samples tested, right? So that has changed significantly. What has also kind of changed for us, we have observed is, in the prior to COVID, a lot of this usage of the platform was by people who were largely centered in the urban locations, and when the doctor is not available in the doctor hours, right, doctor office hours. For example, if your doctor is only working up to 6 o'clock in the evening, post that, if you want to consult a doctor, who would you go to, right? So that was the use case, and we also thought that was the use case. But post-COVID, what we have seen is predominantly women adopting this platform. Now there is a mode of use case, and in fact, gynecology tends to be the second or third largest topic which has been addressed on our platform, followed by pediatrics. That's again women-driven. Where mother is always anxious and always likes that a doctor is available 24/7. So our specialists are available 24/7. 20 specialists, 20 different kind of specialties in 18 different kind of languages. So you can reach out anytime. In fact, 70% of all our doctor consultations happen post 6 p.m. and before 6 a.m. So it's a kind of shift in the kind of adoption which we have seen. The more important is the mental health conversation, which was not happening prior to COVID, kind of came back heavily after COVID, because almost everyone, like doctor was saying, right, even a physician was stressed days, and observing these kind of trends, especially the wave 2, kind of created even those watching television news. Forget about the television anchors; they are always stressed, but at least, right? Even those.
They stress others.
Yeah, they stress others. They're kind of stressors, right? So, in fact, I think that's one of the advice. Don't watch too much of news. Anyway, going back to that point, I think mental health conversations have kind of significantly improved on our platform. Today, it has become like the third, fourth kind of largest conversation. The reason for that is, and I'm kind of, we're talking in the area where what we do, it's also because the health tech for good, right? Privacy and stigma was a problem when it comes to gynecology or mental health, right? And that's the problem which we have solved. So the conversation you have with the doctor is only accessible to you, and it's not accessible to anyone unless the new ABDM framework, where you become ABDM is, sorry, I forgot the name, but it's Ayushman Bharat Digital Mission. The government of India has kind of taken this forward, right? Unless you, as a customer or a patient, who give consent for it to be carried forward to the other doctor, which also we enable. We not only enable for the patient, but we also enable for the providers. So the front end, what you see is one app for a user, but at the back end is multiple apps, which means a doctor has an app. So in a way, we can digitize all conversation happening with the doctor, and then transfer it to the whichever patient, or the interoperability which we can bring in. Similarly, it goes with the hospital. Similarly, it goes with the labs and also the pharmacy. So I think we're kind of already running a small mini ABDM strategy in a smaller way. And there's also this part of insurance which Dr. Amar spoke about, right? I'll just take one more minute to talk about it. I think when we talk about healthcare, health tech, delivery and so on, one of the important element, and I strongly believe that healthcare delivery and healthcare financing are not two different subjects, right? They have to go hand in hand. And that's also why the government of India actually kind of pushed the Ayushman Bharat scheme, and also the Prime Minister's scheme for life insurance and health insurance and so on. So we also run our own claim rules engines. So it's completely health tech driven. The backend AI/ML driven, so that when a customer who walks in through a platform, if it's covered by any of this insurance schemes, including the national insurance scheme, it recognizes that, and a cashless payment is made. So it goes back to that concept of JAM, where everything is cashless, paperless, and physical presence less. So I think, to me, that's what health tech solves today. It's not just about the delivery side. It's not about just the financing side. It's like the entire ecosystem. At the end of the day, what we intend to develop and deliver is that affordability, accessibility, and quality of the healthcare. And just to elaborate on accessibility, I already spoken about, right? We can offer any specialty of doctors at post office hours. The affordability is it's an interesting topic, and I will not elaborate it too much, but because we were able to introduce an AI ML technology, which we call it as Clara, which pretty much operates like an junior doctor, we are able to help the doctor to make quicker decisions and quality decisions, right? Therefore, a doctor who used to spend 10 minutes in actually taking the entire clinical history and then making a decision is now aided by a clinical decision support system, which helps him or her to make a quicker decision. Therefore, the time spent with the patient is still high, but the quality of time is good, and therefore they're able to spend more time with more patients in the same given time, right? So therefore what happens is the cost of healthcare, at least on our platform, is significantly lower for a specialist than when compared to when you would go to a physical world, right? I'll stop there, but I will come back if any of you have questions. Thank you.
No, just brilliant. And I think two, takeaways, what I would think is, one, the inherent kind of advantage of the technologies, what you spoke about, the privacy stigma. So it is something in health we should always see the human-centered approach where it creates. And the COVID was again an example where the physical kind of limits, they were overcome by the technology. So I think what we also see similar kind of government platforms like eSanjeevani, right? And we are proud to kind of observe that like the other countries have mostly around 2 million conversations. At currently, Government of India has 6.4 million conversations just on eSanjeevani platform. So I think there is as you pointed out, there is always a demand. We did not realize so far, and now we are just actually kind of using the true potential of this technology. But really great insights. I think the adoption piece is also the thing which is kind of available through this mental health, right? Which are some of the neglected area where people really did not shy away kind of now with this secure platform. And also you talked about this ABDM, so we will have this longitudinal cohort data for all citizens of India. So this is something the digital ecosystem provides. Thank you so much again. We'll now switch on to Mr. Parthasarathi. I think to his introduction, I will add two more things. Like he has a postgraduate in social work, and he's a renowned writer in CSR magazine like Ethics and Corps. So I think would like to know from, of course, AkzoNobel is a globally renowned company, and would like to also know about your CSR work. But in addition, because earlier two speakers are from the health industry, and we are always, like we are very pro on kind of getting everything on this pendulum, but would like to also know from your experience of, you have extensively worked in the remote area as well. So what are the shortcomings which you see the tech for the healthcare industry, and where we need to be have a right blended approach before kind of zooming on and just going on just that, like, okay, India was on one model now, and then we are now in the second model. Thank you.
Thank you, Dr. Shah. Good afternoon, everyone, and really great to be back with physical, India CSR Summit after a long gap, and I'm sure we all were dying to come back and have a face-to-face discussion. So, to quickly talk about AkzoNobel, it's a Dutch MNC with paint and coating company, over 200 years old, started by Sir Alfred Nobel. In India also, we have been operating since 80 years. And to talk about CSR, which I look after, like, our flagship program is AkzoNobel Paint Academy, where we provide vocational skill training to youth, largely in the paint, in vehicle as well as for decorative paints. Then we have an education project for children. So we work with the government schools to provide supplementary education, to promote life skill education. And coming in the third portfolio of telemedicine. So telemedicine, we have two models. So one is the hybrid model, where we have tied up with the government health departments, the primary health center, where we are working with the government of Madhya Pradesh, government of Assam, government of Jharkhand, and So we have telemedicine centers going on, assisted by telemedicine health workers. And the other program is of Arogya Sakha. It's a telemedicine program meant particularly for the people in the blue-collared sector, and we started it during COVID because people like us were struggling to get doctors. So you can only understand what was happening to the blue-collared workforce. So they were struggling a lot. So at least it's a interface where through a smartphone or even if in a feature phone you can interact with the doctor and you get a prescription through a WhatsApp or even get a hyperlink which can be downloaded. So this is briefly about what we do in CSL. Now coming to the questions, what are the issues and challenges which we have seen in the past few years. So first of all, in urban areas many things are available, but things change really a lot when we go to rural areas. And in my past also I worked in rural parts of Rajasthan, Andhra Pradesh, Assam. And what I've seen, there's a lack of technology adoption. There's resistance of people, there's a lack of availability, people are skeptical what technology will help. These changed a lot during COVID. There was a fresh push, like, for example, 2017 onward, we have been working telemedicine project. But, there was a resistance from the people. But 2020 onward, suddenly I see a lot of openness among the people. So that's the first one. Then there's the digital risk, cyber security issues, integration of data, patients' data, that is a big issue. There's a lack of trained manpower, which I personally seen, especially in working in Rajasthan. Like, there was no radiologist for the entire district of Barmer. So it was a big issue, So you can imagine that. Then, of course, though, even the last 10 years, there have been a lot of internet penetration in rural parts of India, but internet speed, even electricity things, a basic thing like electricity becomes a major hindrance. Then talking about interportability of data, patient data, availability of digital health records, lack of availability health records, which what I've seen, people in the villages, they don't always carry or sometimes lose their records. All the data is gone. So again, the doctor has to make a fresh beginning, which makes it difficult. And the last point is, of course, the warmness of meeting a doctor in person is very different than talking to a doctor over phone. So that empathy things, often, especially in the people in the village areas, they're not very comfortable with it. They want to get themselves physically checked. So that's that's been our experience. Now talking about the blended approach, we strongly believe that not only one approach will help. There has to be a blended or a hybrid model where technology has to be there, like telemedicine or other things, and similarly the traditional approach. So certain things can be addressed, like India is a country where there's a huge gap if patient to people, doctor and patient ratio. There's hardly any availability, 0.7 doctors available for 10 people in India, which is really a big gap. For things like that, definitely, telemedicine or teletechnology can help. But then again, not in every cases. So at least for the initial interface or for diagnostic services, it can be helpful. But if it's a serious case, of course, the patient needs to be referred to a bigger hospital. Similarly, in cases of follow-up cases for lifestyle diseases, it can be a good medium. It can be a good instrument. A good, again, example of, like as I was checking about, radiological services. Like, there's hardly trained radiologists in smaller locations and the salary they draw is huge. So often government can't afford radiologists and so there's hardly anything available. So again, what we have seen is teleradiology have been very effective in these locations. Like, available of trained manpower is available in the bigger city, and through teleradiology, all the data which is being interpreted in bigger cities and is sent back to smaller towns and smaller district cities. But then obviously there has to be a more push from government in better health delivery systems, improve infrastructure, and adaptability of people, openness of people to technology. Thank you.
Yeah, so I think you brought out two really important points, and I think we always struggle with that the work culture right? So capacity building, traditionally, we also have seen that like the technology is there, but adoption is really different. Even there is a digital signal, but people don't react to those digital signal in healthcare system because they are not used to with those kind of system, even the meeting or the supervisor visits. So one is that, and second, I think, is also the rationalized approach. It's nothing that like we have to use technology in everything. So wherever there is a rationalized approach, as you brought it out, where there is a scarcity of the radiologists, and where the teleconsultation makes sense, we really should be going it. It's not something where human touch is required. You of course can do the scale deployment, but followed by the human in loop structure. So I think that's phenomenal. And third point, I think you also brought out, there is a skepticism still in the common population in all this sphere of the news about security, data, privacy. And of course, one of the gentlemen I was kind of talking to yesterday, he said that India is a land of paradox and the contrast, where you will see India based on where you are standing. So basically in Delhi, the land of 5G, people will say that internet is available, but I myself went to some of the remote places in Sahibganj last week, and even the making a phone call was difficult. So we need to realize our limitations. Of course, we need to work on, but you brought two important points. The technology has so have to work in with the digital infrastructure, which I think government is improving. But as a civil society or as a responsible citizen, we also have to work on those. But really good. Thank you. So I think I was reading for this thing, and when I noticed that Indian healthcare industry is growing at annual growth rate of almost 23% now, and which is phenomenal. We have almost touched $400 billion as an industry, which is good to know. But I think what we also see that, and specifically where I come from, that we see many of the innovation solutions, they go start, the donor funding goes down and then they stops, right? So there is no continuum. So whenever there is a successful experiment, we don't see that natural continuity up there. And so I think he also touched upon the affordability case, accessibility to masses. So Mr. Narendra, and I think you are that perfect person. He comes from Cholamandalam CSR's initiative, and he's also passionate about social justice. So I think one thing which I would like to kind of ask you is, or maybe two, is one, how this public-private partnership can work to make a sustainable solutions. Second, I think how to make sure that we are also addressing the bottom of pyramid population. Thank you.
Good evening, friends. I'm Narendra. I come from Cholamandalam Investment Finance Company Limited. We are largely into commercial vehicle financing and other forms of financing in terms of home loans and home mortgages and stuff. We are part of the Murugappa group, which is about 120 years old, and Cholamandalam has been in existence for about 45 years now. We are very passionate in strengthening social infrastructure and to nurture communities. We've always been very passionate about this part of even in our own business, and we've been doing the CSR for quite some time before it became regulation. And right now, I think we're just ahead of the regulation that's come in even recently. So to answer about what we do in CSR, we are present in about 1,200 locations as of now, and we cater largely to the unorganized sector. And we found out about this trucking community, which forms a very large part of the unorganized sector. Close to about, I understand the last data that we had was about 5 to 6 million drivers are available in India, and out of which 2 to 2.5 million drivers are considered to be long distance drivers. And these long distance drivers drive through different terrain, different conditions. There are roads, there are no roads, there are it's a crazy way to live. Most of their life is spent on the road, on the highways, with very little access to what you and I will get in Delhi, healthcare or anything. They are away from the families, so the family suffers. So there's a lot of problems, challenges that this community faces. So and that significantly we found that leads to a lot of road accidents as well. So that's going to be affecting all of us. These guys are stressed out. They're driving on the road non-stop for long distances, and they haven't they haven't seen their family. They're worried about it. They are worried about their health. The mental stress that happens, and these guys literally move wealth around the country. Apart from banks, these guys physically move your wealth from different parts of the country. So this is a very, very important segment, and we figured that let's start there, and we started out by doing eye care testing for them, and we've covered about 350,000 truck drivers so far, and we're still covering up. I think we have about 30 locations today in 15 states, and we covering every day. We want to do more. We've partnered with with a lot of partners who are helping us achieve this dream. So to reduce accidents and all of that. So that's where we started, but then we realized that since we are in 1,400 locations, we started off with the Golden Quadrilateral, and then we've spread across the country. We're delving away from keeping the core still as health. We're doing a lot of stuff in education. We're teaching the trucking community and the commercial vehicle community on financial literacy, and because they need to understand their income is not regular. Their income is very irregular, and we teach them financial literacy. We take care of their health for the families. The children, we discovered that there's a large population of children who are born with congenital heart diseases. And we have only 60 centers across the country that actually, deliver this service. And I think the last number was about 240,000 children are born every year in 60 centers. It's just not sustainable. So we thought of undertaking that mission as well. So we are in a mix of while we work on all sustainable development goals. Largely our focus is community building through healthcare and education. So that's where we are. And this is definitely not going to be possible to achieve without public-private partnership. While the government has come out with several schemes, like Dr. mentioned, it depends. The last mile connectivity needs to be taken over by the private companies to ensure that we reach the last citizen standing in the country. So that's something that we will have to look at. Also, in terms of we want to take healthcare to the bottom of the pyramid. That was the last part of the question, because the unorganized sector, and as I was telling you, the trucking community or the commercial vehicle community, be it drivers, cleaners, ambulance drivers, taxi drivers, these guys form a large part of the unorganized society, and costs, the cost and the affordability, which Ashok spoke about. This is something that we've been grappling with, and I think Chola wants to, and it has been in the forefront of taking this technology, and as Kirti mentioned, there's no scale without technology. So we will need the scale, we will need the technology to meet a large requirement in the country.
So I think, and thank you so much. And I think we need to realize in India that not a single, for anything, it's not a single player who can kind of do all. And we really need that multi-stakeholder engagement. And this is that perfect example where government, with all good intent, still cannot serve all the population with the traditional approach. The example you gave is a tremendous, that trucker companies, their needs are really different, where we need to adopt based on their kind of work profile or the lifestyle. And so that extending those services, and I think that is also the quorum where we also want to see that, like, it's not only the government response, but it's a combined joint response which can help. And really exemplary to see your work actually extending to those last mile. Also, I think the cost effectiveness also comes where the larger local players are get involved. Otherwise, there is always an kind of what we see, that fly out mechanism doesn't work. And I think people really want to, the system need to be in place for a long time. And I think that is also one thing which can kind of go. So I think we have 20 minutes now, and maybe we'll switch the gear. And what I will ask from all the panelists, a very quick one-liner response, what you think about. So maybe I have 2 questions set, but I think something which would like to get your response rapidly on that. One, I think because the forum of this panel and everything, and you also represent these community in that sense, maybe we'll start from here and we'll go there and go from here and there. So be prepared on those questions. One is, I think we have observed your projects. We have also witnessed in the many stalls, many of the initiatives. So one reaction, if you have to provide, how do you see CSR projects can be a catalyst for the integration in the futures to come? What is that CSR would like to invest? One thing which you feel they should invest in the tech in the future.
Yeah, I think I spoke about this when we were talking about the ABDM strategy and the last mile digitization, especially from a provider side. And you brought up that point, right? The provider has to be local. And in most cases, at least in primary healthcare, right, the local provider is not someone whom you think, it's a mom and pop shop, right, more or less. The ability to kind of finance that and also help them to understand that training, financing, training, and probably technology for all is the starting point, at least for this section of the population. If we have to really address this and make it interoperable, I think the work starts there. So, yeah.
So this is where you see the CSR should be also contributing.
Really investing.
Yeah. Thank you.
Thank you.
Maybe.
Amar, so I'm a strong advocate of Make in India, and I believe that we should be making bigger medical equipment in India. Yes. We should not be dependent on US, on China or Japan or wherever it is. I think we should be. It's high time now for Make in India, and I think we should be doing more of that in India. There are 3 things that I just want to quickly take your time. So today there are 3 issues that we have. One is in terms of cost. Second is in terms of skill. Okay, the people are not trained to use those equipment. And third is in terms of regulations. There are very tight regulations for Indian manufacturers to build, and there needs to be a connect between the medical practitioners vis-a-vis the regulatory authorities to understand, and there should be a forum that connects this. I think the time is right now, and we will be bringing down treatment costs if the medical equipment cost comes down. Like for instance, I can talk about 100 devices right now, but paucity of time, I'm not doing that. So we should be making more devices, serious devices, and not just services in India. Second, we should be looking at training our people. Or the investment in artificial intelligence that will take away the need to train people, and it becomes just AI. That's 2. And third is we should be talking we should be easing up the regulations for tested devices. There should be strict norms, but we should be considering Indian manufacturers for that. I think that's where we should be investing on.
Really good. So I think very, very pertinent, both of your point of view, and just One thought on this AI business. 6 years back, when I really recall my first conversation when I was kind of talking to our leadership about funding some of the AI initiative, I had a real fight where I was told that like this is really, really risky investment. And I think we are glad that like now those investments are actually helping in that sense. So both the things, and Make in India is a really strong point, and also the last mile digital footprint which we were to.
Yeah, so whatever can be automated, automate it. So our chairman goes by this vision, Dr. Sushil Shah, founder of Metropolis. He's always maintained that, and we've been around for 40 years, the company. And his whole logic has been, whatever can be automated, automate it. In fact, he just calls up any of the leaders anytime at 10 o'clock. And those who are new don't know that if you give a wrong answer, you're out. So he asks you, what are you doing? And if you say, I'm busy doing this, he said, then we are not moving forward. Because this is the time where you should be having a cup of coffee, understanding the current affairs, and seeing what's next. How do I do it best? And for that, you have to, to be able to strategize, to be able to think, you have to automate all the mundane jobs, And I mean this from the very simple thing, like even, when the samples used to come in the lab and they used to be like, 3-4 boys used to just every day pick up the whole job, the whole day was just to pick up that sample and put it in the machine. And when we put the automator, the automated sorter, and the samples just started going in, and every time I go to the lab and I see those 4 boys and the smile on their face, I think that's the thing. So it's not only for us, it's not only for the rich or for the poor, it's for everybody. So whatever can be automated, automated. Second principle I would go back, whoever can be educated, educate them. Because you can only help somebody this much. But when you educate them, today we are also fortunate because our parents educated us, right? So somewhere somebody is not so lucky. And I think once you wear the CSR hat, I think you have to have, a chill going down your spine. If you approve anything or if you allow anything to happen for the privileged, you have to go for the underprivileged. So you go for the underprivileged, you automate what you can, you educate whoever you can, and you support in the right spirit. And last but not the least, go back and check what you've done. And I think data analytics is what has come out in a very, very big way. And let us not assume that we are beyond data. So if I have taken a decision last year and I do my own impact assessment and I do my own feedback and something throws up that, okay, this has not worked so well, then something has gone wrong in the last mile execution or, in the delivery, then I have to take a step back and I have to innovate and create another product, because obviously this is not what's, just because I created it doesn't mean stick to it, So even God keeps changing, humans as they evolve. He doesn't stick to the same person, or we would all just be clones. So that's it. I just want to say, automate, educate, support the underprivileged, and don't be shy of feedback. Just learn to improve on yourself, and then apply it to health tech, and you'll have lots of solutions.
Brilliant.
Yeah, thank you. I strongly believe CSR can never replace government. The role of CSR is to create out-of-box solutions, create model projects, show it can be done, and then hand it over to the government. And I think it has done many wonderful projects recently. Like, for example, government of Madhya Pradesh have recently introduced telemedicine over 2,000 PHCs, tied to the grassroots level. So one thing I strongly believe is that CSR should create model, work with the government, plug in gaps where government cannot work. One particular area I really believe is IEC, information, education, communication, because there are a large number of government programs and projects, but people are still skeptical about adopting it. So even if it is a case of telehealth or telemedicine, CSR's role should be reach out to people, educate them about the importance, believe in it, and go for it. Thank you.
Excellent. I think both of them brought out really other aspect of this thing and really value of that. One is distinguish your advantage over the government and over like whose roles is this, and so identification of that role responsibility is really crucial, and also something which is an inherent advantage of the technology which we should be using, and we should be thinking that like new generation how they will be utilizing it.